Welcome back, everybody. This Week in America, website thisweekinamerica.us. Thank you for joining us on the program. As mentioned, back with us, Julia Schopick, a best-selling author, dynamic speaker who presents before patients, parenting groups, innovative doctors who want to be better informed and empowered to make the best health choices for themselves, their patients, and their loved ones. She's the creator of the award-winning blog HonestMedicine.com. And again, the book, the bestseller, is called Honest Medicine, Effective Time-Tested Inexpensive Treatments for Life-Threatening Diseases. Julia Schopick, our guest. Julia, welcome back to the program. It's great to have you back with us.
Rick, I am so happy to be back. Thank you so much for inviting me.
Thank you for taking the time to be with us. You have such an important message, and you were with us 3-4 years ago, and you can go to our archives and listen to that program. And there's so many things I would like to talk about today, but let's do the background. You were a very successful PR consultant for over 25 years, had really no desire to get involved in being a healthcare blogger and a healthcare advocate. Talk about the personal experience you went through with your husband, who was a brain tumor patient, and the fact that you kept him alive for years beyond what the doctors thought was possible. And then we'll talk about how you were able to do that.
Okay, I'd be glad to. As you said, I have been a PR consultant. Actually, it's for around 30 years now. I still do.
I was trying to shave a few years off that. So.
Oh, that's okay. I never shave. But in 1990, when my husband was only 40 years old, he was diagnosed with a cancerous brain tumor, as you pointed out. And I want to stress that at that point, I did not start my researching. I did not become the empowered patient that I hope I am today, or I hope I became, let's put it that way. Because when you get a diagnosis of cancer, you're terrified. And that was surprising to me. Not that I was terrified, but my dad was a doctor who had told me to be wary of the medical profession. And still, we went in lockstep with what the doctor said. And that made sense for the first few years because his tumor was the size of an orange, so he had to have the surgery. He also had radiation. And while I doubt the efficacy of the chemo, he did have chemo. And then I began to notice that he was developing every side effect you could imagine, every complication from the treatments, not from the tumor. That had been taken out. But he began to have many seizures. He had a radiation-caused stroke. I don't know if you knew that radiation to the head can cause a stroke, but it can. He had many bouts of hydrocephalus, which is water on the brain, and he had to have surgeries for that. It was a mess. And finally, I got the message, and I said to myself, you better start doing some research. And I did. And I found a nutritionist. The first thing was I found a nutritionist whose area was cancer, and especially a personal interest in brain tumors. And she really took us under her wing, and she changed Tim's diet. She got him on a lot of supplements that were just wonderful. And he began to feel really good, and he was flourishing. And what I noticed, Rick, was that the doctors were not at all interested in anything we were doing. They did notice that he was their star patient. That they noticed. But they didn't want to know what it was we were doing.
Well, that is so, as you read the book, Honest Medicine, that is so shocking as you're reading, and it's like it's almost you against them. What they said basically, optimistically, maybe you could expect 3 years of survival. It went on for 12 years beyond that, basically because of what you were doing, the homework that you were doing, the research, the implementation of that.
Well, I remember, Rick, we were in the neurosurgeon's office. We went for regular visits there, and the neurosurgeon asked Tim what meds he was on. And Tim reeled off the names of the meds. He had a little paper there. And he said, but I'm also on a lot of supplements. And the doctor said, I will never forget it. Next question.
Wow.
He was not interested in the supplements, but I have to tell you that I was quite selfish in a sense, because at least nobody was stopping us from doing what we were doing. And Tim was just happy as he could be. He was boasting to all his friends. The way he put it was, she's a doctor's daughter. She knows everything. Well,
Well, and our guest on This Week in America, who knows everything, and you'll find it in the book. It's such an excellent book. Honest Medicine, Effective Time-Tested Inexpensive Treatments for Life-Threatening Diseases. Julia Schopick, and that's spelled Schopick. She's an award-winning healthcare blogger and healing expert, Julia Schopick. The website is honestmedicine.com. Very easy to remember. And there was for you that aha moment where everything started to click and you really thought, I'm on the right path here.
Yeah, there was. It was a big aha moment. And that was that in 2001, Tim had a recurrence of the tumor. And I want to stress that usually these recurrences come way before 10, 11 years, if they're going to happen. And usually they do. And at that point, it was horrible because his skin, remember I mentioned that he had hydrocephalus
Yes.
And they had to put shunts in? Well, they had to do surgeries many times. And remember, his skin was radiated in the beginning. So this time I had an awful feeling about this surgery. I said to myself, and I said to the doctor, I made an appointment to talk with him. I think he's going to have trouble healing this time. I don't think he should have the surgery because this time it was a very slow growing tumor. I just dreaded this surgery. And the doctor said, oh no, it's going to be a piece of cake. I found out later he meant for him, because the tumor was right near the surface, and he meant that it was going to be easy to get at. Well, it was easy to get at, but I was right too. The suture line, the incision line, just didn't heal. And Tim went through 8 additional surgeries, 8, in order to find 2 pieces of skin that would hold together. I mean, that was the sole purpose. Remember, the tumor was out, but this was just a mess. And with each surgery, he got more and more brain injured. This was a man who walked into the surgery telling jokes. By the time he had the 8 additional surgeries, they had actually taken pieces of skin, grafts from all over his body. I mean, it was just horrible. And by then, he was severely brain injured. He was almost paralyzed, just involuntary movements, and he was bedbound, and he was incontinent. And at that point, I was looking for answers. And finally, serendipitously, I was talking as part of my PR job to an integrative doctor, and it was on behalf of one of my clients. He was not a client, but he asked how my husband was because we did know each other socially a bit. And I told him, and he said, have you ever heard of Silverlon? And that's Silverlon. It's one of the treatments I feature in my book, In Honest Medicine. And I said, Silver what? And he told me about this incredible treatment. It was a product, actually. It was pieces of material impregnated with silver ions. And he told me, Dr. Reynes told me, that this treatment was FDA approved for all non-healing wounds, and that he was sure that it would have a good effect. He himself used it for diabetic wounds and for burns, but he said there's no reason it shouldn't work for your husband's suture line. So I got on my PR horse and I called the president of the Silverlon company, called Argentum, and the president was named Bart Flick, an MD. And I got permission from the doctor. It was an incredible story. It's in Honest Medicine. I can't tell the whole story, obviously, but we got permission to use the Silverlon on Tim's head, and he was in the hospital, so that was quite an undertaking. In the hospital, they don't like you to bring in any treatments. They like to use just the treatments they have. It was put on his skin. I must say that Dr. Flick donated the Silverlon to us, and within, I would say, 24 hours, it was obvious for the first time that his skin was finally healing. And this was, to me, miraculous. And I was sure it would be miraculous to the doctors as well. I mean, this is something that happens routinely to brain tumor patients, especially if they've had radiation previously. And they weren't as excited as I was.
Well, why is that? Why is there this resistance? Because they want to heal. And in the book Honest Medicine, you talk about they really look at expensive drugs, expensive surgical procedures. Is that the core of the problem? Is money in many cases?
By the way, my dad, if he were alive, would have said yes. He would have said, Rick, he would have said that's the core of it, because he used to tell me about doctors doing surgeries just to make money. And, it's terrible. But I think that the answer is more in tune with what Dr. Bert Berkson says in my book, In Honest Medicine. And he is one of the heroes of the book. He says, doctors are trained and not educated. I want to say that slowly. I know I talk quickly, but training is different from education. Education means that you're curious, that you want to look outside the box. Do you know what I'm saying? It's
exactly what you're saying. And Dr. Bert Berkson is a hero and one of the good guys that you'll read about in the book, Honest Medicine. And that really makes so much sense. So it's not necessarily in every case where it's dictated by dollars. It's just that but they're not curious. They just follow a routine, and that's pretty much it.
And you know what? I don't want to discount the idea of follow the money. Because, for instance, in the cases of all the treatments, of the 4 treatments I write about in Honest Medicine, the usual treatments for these conditions are very, very expensive and in many cases very, very toxic. So that's where I get into, doctor first, do no harm, the Hippocratic Oath.
Yes.
Where they really looking outside the box. I mean, they're not. I picked treatments where what the treatments the doctors were recommending for these conditions were not successful. So these treatments that I picked are inexpensive, where the treatments doctors like to use are expensive. There you go with follow the money, right?
Yes.
And they're toxic. The treatments the doctors tend to use are toxic, the ones that the pharmaceutical companies teach them about. And I use the word teach rather facetiously.
The book is, there's so much in the book. Honest Medicine, effective time-tested, inexpensive treatments for life-threatening diseases. Our guest on the program is the author Julia Schopick. She's an award-winning health and healing care blogger. The information available at honestmedicine.com. The book's available all across the country. Information, like I say, there at the website, honestmedicine.com. You always link to our website, thisweekinamerica.us. The book is filled with examples and tales of average people who went from passive patients to powerful advocates for their own health. And that has to be so rewarding when and I know you wrote the book because you really didn't want people to go through asking themselves the questions that you were asking yourself. Did I do everything that I could have? Did I explore every option? They're there, and it has to be really rewarding when people say, because of you, we actually were able to find something that's working.
Yeah, Rick, I still cry when I get those emails.
Oh, I'm sure.
And because I love going on radio, as I think you can tell. It's just a pleasure for me. So after each appearance, I do get, it's usually emails and sometimes calls. They track me down, but they write to me at julia@honestmedicine.com and they say, you've told me about a treatment that I didn't know about. The ones who write mostly are people with autoimmune diseases, because one of the treatments I write about, low-dose naltrexone, or LDN for short, is a treatment that is inexpensive. It's been around since the mid-'80s, and it works for so many autoimmune diseases, and there are over 100 of them, Rick. And, people just write to me, and then I help them to get the treatments that I write about in Honest Medicine. Then they often write back, and this is where I cry, where they say, you changed my life. And I say, no, I didn't change your life. But, finding out the information, it's education that I'm all about. So
you mentioned Silver Line. There are 3 others that you talk about in the book in Honest Medicine, and they have really wide applications too, don't they?
They do. That's another thing. You mentioned that, and I usually don't put it this way, but doctors are used to treatments that, one symptom, one treatment,
right.
And these treatments that I write about, and I'm happy to tell you to tell your listeners what they are, they actually work for several different, modalities, for several different diseases or conditions. The one that probably has the most applicability is low-dose naltrexone. And I know we don't have time to tell the whole story, but it does work for a whole number of autoimmune diseases. I also write about the ketogenic diet. and that's used primarily for pediatric epilepsy, but I'm doing a revised, enhanced, updated version of my book of Honest Medicine, and in there we're going to be talking about the fact that there are now studies being done on how the ketogenic diet, which is a high fat, low protein, low carb diet, how it may be very, very good for Alzheimer's, for ALS, that's Lou Gehrig's disease, for Parkinson's. I mean, the applicability of these treatments is just huge. And of course, the intravenous alpha lipoic acid, which Dr. Berkson used originally and still does for end-stage liver disease and has saved many people from having to have liver transplants. He also uses it for some cancers, for some autoimmune diseases. So doctors just don't understand this idea of one treatment for many diseases.
Well, yeah, in a lot of cases, and I don't mean to generalize here, but in a lot of cases, doctors will get information on what's available out there from pharmaceutical representatives who obviously aren't in there pitching the particular products you're talking about here. If somebody is listening and they want to get information and they get more information from Honest Medicine and they decide to present this to their doctor, how do they go about presenting this to someone who may not have any understanding of the product they're talking about?
Well, this is a very, very good question. And this question was posed to me so many times. People would actually write to me, I'm afraid to talk to my doctor because I know that he won't be interested or she won't be interested. So I've developed some teleseminars where I teach people how to go to their doctors. And I also coach people in going to their doctors. But the short answer, I guess, would be that I teach them to bring very carefully selected articles. I'm going to say articles and other information to their doctors. Don't go to your doctor with a whole bunch of internet, handouts that you just have willy-nilly all over the place. Don't do that. As a matter of fact, when doctors hear, somebody called me yesterday. She goes, I left a message with my doctor and I want to see him about low-dose naltrexone. And I'm going to tell him, that I found it on the internet. I said, don't do it. Don't say that you found it on the internet, because doctors hate, that they hear this all the time. And the idea is that I help people to present information to doctors in a way that is doctor friendly. Showing the small studies that have been done, maybe with treatments like the ones I write about in Honest Medicine. Pharmaceutical companies do these big phase 3 trials. Well, no pharmaceutical company is going to want to do a trial for a treatment that's not going to bring them much money. That's for sure. But there have been small studies on low-dose naltrexone, as a matter of fact, small studies that were done at prestigious institutions like Stanford, Penn State, University of California, San Francisco, and published in very prestigious publications. And all of them are all these small studies are on PubMed, which is the government site that doctors love. So presenting this kind of information and presenting it intelligently. Oh my God. Don't just come in and say, I found this on the internet. And by the way, this woman, no, I forget her name. She wrote this book. I forget its title. That's just not going to go.
Yeah, and that's so important, because what you have here is like legitimate remedies, legitimate medications, all well documented. Yeah, when you talk about the internet, I'm sure these doctors go, okay, here's another wild internet story, because anybody can put something on there. What you are talking about are so well researched. The book is Honest Medicine. More than 100,000 people worldwide have been helped because of the book. Effective, time-tested, inexpensive treatments for life-threatening diseases, including multiple sclerosis, epilepsy, liver disease, lupus, rheumatoid arthritis, and other diseases. You're doing such an excellent job. We have a minute left in the program, and we definitely will have you back. But it sounds like you're making progress. You really are getting people to do research on their own, using the resources in Honest Medicine, and it's resulting in a better quality of life for many, many people.
I'm so excited about that. I had another career before I was a PR consultant. I was actually a teacher. I was a college English teacher. So that kind of comes in handy too.
Yes. Well, you can tell with the presentation, because it's like, okay, this lady knows what she's talking about. Things are documented, well researched, and it's making sense. And you have so many medical experts that you talk in the book. I mentioned the Dr. Berkson, and it's so powerful. And you do the stories in the book, and you've got real people that have decided to do some research for themselves, start asking questions, and be an active participant in the medical process. The book is Honest Medicine: Effective, Time-Tested, Inexpensive Treatments for Life-Threatening Diseases. Julia Schopick, our guest on the program, award-winning blogger and healthcare and healing expert. Thank you so much for being on the program. Great to have you back with us, and definitely we'll do this again.
Rick, I can't wait to come back again. You're a wonderful interviewer. Thank you so much for the opportunity.
Well, I really appreciate you taking the time to be with us and to share your story with our audience. And again, the book is called Honest Medicine. Information available at Julia's website, which is honestmedicine.com. And of course, information at our website, thisweekinamerica.us.